Hello everyone, this is Eric Hong, Executive Director of the Momiji Healthcare Society, speaking to you again about the COVID-19 pandemic. As weather warms up in the month of May, many of us are hoping that the COVID-19 pandemic might go away with the winding down of the annual flu season. There is some good news. Public Health is reporting that the rate of increase in new COVID cases seems not to be rising at as frightening a pace as it had over the past month and a half. However, it is also not falling yet. It is just holding at a level for the moment. The pandemic as a crisis is not yet over. Different places around the world are beginning to attempt gradually lifting physical and social distancing restrictions and allowing selected types of business to open and other public activities in daily living for people at large to resume. They are doing so carefully and slowly. The rest of the world is watching closely to see if it is safe to do likewise. The province of Ontario is also moving in that direction, but doing so with deliberate caution so as not to risk triggering any regrettable and avoidable resurgence of COVID-19 spreading. Perhaps, indeed with the coming of spring, there is cause for cautious optimism. At this point, I would like to take the opportunity to thank our volunteers. As the COVID virus spreads, there has been and continues to be a severe shortage of many much-needed pandemic supplies. Protective face masks have been one of the number of personal protective equipment that have been in short supply. It is essential that our care staff have access to them. It is important that our tenants and visitors can minimize risk of passing the virus around by wearing such masks. Fortunately, volunteers, many of whom have had to curtail their regular volunteering activities, have stepped up to the plate and produced handmade masks for Momiji. For this thoughtful and practical help, I offer the heartfelt thanks of all of us at Momiji. With the reduction in international travels, infection prevention and control attention has been shifting to focusing on reduction of community transmission risk of COVID-19. You have likely seen in recent media reports that some grocery stores have started requiring that customers wear a face mask or other face covering when shopping. This is to strengthen a barrier now deemed necessary to inadvertent spread of the COVID virus. Momiji has also now implemented a similar no mask, no entry rule. Effective immediately, all staff are required to wear a mask on site except when they are working alone in their own offices. All tenants have been issued one of the handmade masks made by our volunteers and are asked to put them on whenever they are not in their own apartments. All visitors, including families of tenants, service providers, and contractors coming to Momiji are required to wear a mask. We cannot and will not guarantee that we will necessarily have a mask available to be issued to any visitor at any time. But while supply lasts, a visitor will be given a mask on the first occasion that he or she attends Momiji without one. Any visitor who does not wear a mask will not be allowed to enter into Momiji, which is considered private property. This may seem drastic and inconvenient, but it is necessary. It may even seem draconian, but given the vulnerability to infection of the older population that makes up the tenants and Momiji, their frail health status, Momiji is compelled to do what it must to protect them from harm. The no mask, no entry policy has been adopted after much deliberation and consultation with the appropriate authorities. Once again, I ask that all Momiji Seniors residents tenants and their families cooperate with us and abide by this no mask, no entry rule. As we work together, it is hopeful that the pandemic will not stay with us for long and that we'll be able to enjoy more normal life very soon. Thank you very much.